nurse with Home Instead Senior Care. By now you're starting to learn what the word observe means from your in-service here with Janice. Well, there's a few topics that I would like to explain in a little more detail. First of all, in the Caregiver Journal, you have your charting notes. It looks like this yellow note right here that you've used to been, doing some charting in. We would like to expand on the way you chart. So think about a recipe. Have you ever received a recipe and it said a pinch of salt or flour until it looks good? Well, what I think looks good and what you think looks good might not be the same. And maybe I've never seen this before, so I don't even know what it should look like. So just like as a caregiver, we need to know exactly how much assistance for walking, how much assistance for bathing, so we can safely help our client with their bathing, walking, etc. So if your client is performing a specific task, for example, mobility, and they're doing it the way they're walking the way they always walk, that is considered their normal baseline. If they have a change from this normal baseline, that is something different that you've observed. So, how do you observe a change? You want to be like a detective, looking or observing for little changes. Examples are, maybe when the client stands up, they take a few side steps, or maybe they take a step back, or maybe they stand up and fall back in their chair. Or maybe they look like they're not feeling quite right. They're not drinking as much water. Maybe they're urinating a lot more or hardly at all. These are little changes that are important to look for and make sure that you chart down so that we know, and please call the office. So again, if you observe a change, you need to chart it. So what we're doing moving forward, if your client is at the normal baseline for, say, walking. So under here, there's mobility. If you check the box, that means that's their normal baseline or what they've always done the same way. If it's different, then you need to go in the shift notes section and you need to describe or write what is different. What did you observe? So here's some tips on how to chart in detail. So there are different levels of assist. There may be a monitoring assist where you're observing or watching the client from a distance. It could be a couple feet, it could be across the room. You don't want to be staring at them, making them nervous. You want to just occasionally glance or just in the peripheral vision, the corner of your eye, just watch and see what's going on. And that's for the client's general safety. You may need to assist with verbal prompts or cues. These are verbal or visual reminders. So for example, on the count of 3, we're going to stand up. 1, 2, 3. Push up and off. Turn here. And a visual cue may be brush your teeth, and you're visually showing them to brush their teeth. Or get dressed. You'll put your arm in your sleeve of your blouse. Next topic that I'd like to discuss for safety. So this is for the client's safety, and then also we're going to break it down into your safety. Number one important thing that needs to be done, your client needs to have some good, sturdy, hard-soled shoes or slippers, preferably that have a good grip or base. So, and then before they stand up, they need to have a wide base of support. So you want your feet at least shoulder width apart so they have a good sturdy support. And if the care plan says they need to use a gait belt, you need to use it. If the client is resistant to the gait belt, you want to remind them that it says in their care plan they are to wear their gait belt for their own safety and for mine, or for yours, the caregiver. If they're still resistant, call the office and ask for me, and I will follow up with the client and family and educate them further. Another thing to think about is before they get up, as we age, we have changes with our muscles. So all muscles in the body get weaker. So your heart's a muscle. That gets weaker. It's not as good of a pump. And there's muscles around all of your vessels in your arms and legs, so they don't work as well. So when an older person changes positions, so from sitting to standing, the blood is taking longer to get up to the head, and they get dizzy and get kind of whooshy, and that's a big fall risk. So encourage your client to stand up, catch their bearings for a few moments before they take their first step. That's a good prevention of falls. The next topic we're going to discuss is body mechanics and safe transfers. As a caregiver, you're always taking care of everybody else. Well, now it's time to take care of yourself. The safest way to transfer is using the right muscles. So you have these nice big muscles in your legs and in your butt. You want to use those versus the little tiny muscles in your back and spine. So think there's an imaginary line between your head and your pelvis. You want to keep that as straight as possible, your legs bend, and you slightly stick your butt out because you want to make sure your knees are behind your toes. So when you squat down, my knees are behind my toes, I'm slightly sticking my butt out. I'm using all these muscles which they're intended to do. And another important tip to add is your sturdy soled shoes. So you want a good pair of shoes, and you want to have your good wide base. Just like you want to educate and remind your client to do, you want to do that for yourself as well. Okay, a second tip that will keep you safe and prevent injuries is breathing correctly when you bend down and stand back up. So when you bend down, you want to breathe in or inhale. And you think about it's like a balloon. You're filling air in the balloon, you're filling your not your abdomen, but you're putting pressure down here. So then when you go up, you want to blow out or exhale. That way you're taking all the pressure off as the muscles are bringing you back up against gravity. A third tip that will help you to prevent any urge incontinence, stress incontinence, or hernia is to flex, contract, or relax your pelvic floor muscles in the same rhythm as you're breathing. So when you go down to the floor, your pelvic floor muscles go down. When you come back up, your pelvic floor muscles come back up. So when you go down, you want to relax. When you go back up, you want to contract. So again, when you go down, your pelvic floor muscles go down. When you come back up, you can contract or you flex, your pelvic muscle comes back up. Now, we're going to educate our clients for Let's Get Moving. This is right from the Home Instead website. Physical therapists design this. It's safe for everyone. So it's mobility activities or exercises that caregivers can assist their clients, remind them to do. Now don't get hung up on the props. So for example, the power grip. It says to squeeze a tennis ball. Most clients probably won't have a tennis ball in their home. That's okay. Just roll up a washcloth or something on that order that they can just go through the motion. The important part is the movement, not the prop. Another one of the mobility activities is circle scarves, where you take a scarf and have it go like this. Well, if they don't have a scarf, that's fine. I bet almost everybody has a flour sack towel because they used to make their own bread. So use a flour sack towel, or a silk blouse would do the same motion. Another activity is day at the beach, where you're supposed to hold on to a beach ball. They probably don't have a beach ball, that's okay. An empty box, like an empty ice cream pail, something that's light and that they can hold on to easily to go through the motion. Another tip is if you're working with someone that had a stroke, you need to keep in mind that on their affected side, yes, you can see that their arm or their leg are affected, but their vision is also affected on that side. So let's say the person has right-sided weakness. Now, one of two things could happen. They could either be blind, have poor vision on their whole right eye, or both eyes from the center to the right could be blind or impaired vision. So it's so important to be conscious of where you are sitting in relationship to them. So if you're assisting them with, say, standing up to walk, if they can't see you over here and maybe they're hard of hearing, they're not going to be able to understand what you're doing. So be conscious of which side you should be on when you're working with someone after a stroke. So we're going to discuss a rug safety and removal process. I know rugs are a big tripping hazard and they should always be out of the house. However, you know, this client, they're in their own home because they want to be in their home, they want to be in control to a point, and they want it to feel like home, not a clinical place. So maybe we can come up with a compromise. Maybe we can move all of the rugs out of the way except for their favorite. And maybe their favorite one can be put off, you know, in the other formal dining room or over out of the walkway, just so they can still see it, that they're happy with it. Another thing is to make sure it has a good backing. If it's a rug going on like a tile or hardwood floor, you know, they buy the backing that keeps them in place. Even if you have the backing on that rug, you want to check it daily or every shift or every time you are working with a client, you want to check the rug out for safety. It's a little trickier if they have carpeting and they want to keep the rug over the carpeting. What I found what works best is getting the double side like packaging tape and using that, make sure all the corners are sealed down nicely, and then in the middle. Again, you want to check that daily or every shift that you are there. So if you've tried all of these alterations and it's still, they put their walker over it and the wheels are bunching the carpet over it, then it's really a risk. It needs to come out. So I came up with a 1, 2, 3 strikes and you're out process. So 3 separate occasions you want to tell the client you're going to remove the rug. You're going to remove the rug and put it out of sight. Document where you put it. And then each time when you come back or another caregiver comes back, is the rug back in place? So if after 3 separate attempts, the rug's been removed and it's been brought back in place, call the office and ask for me. Then I need to maybe do a home assessment, talk with the client or family, and educate them on the fall risk. The final tip is being mindful or aware of your environment for both your safety and also your client's safety. And if there is an emergency or crisis situation, it's good to be mindful. So, first thing, when you get into your car from your home, make sure all your bags are packed. Have all of your things the way you want them, all your bags, it's all set up. So that when you are driving up to the client's home, you are scanning the environment. You're looking for overgrown hedges, snow, ice removal or lack of, people around, unusual type. You're just looking for anything unusual or resources you may need in a crisis or emergency situation. So when you pull up and you park your car, when you get out of your car, grab your bags. Don't be fumbling with your bags. You want to grab your bags and you want to observe, or you want to see your path where you're going. You're looking for like the snow and ice again, uneven pavement, big heaved up cracked pavement, broken steps, a risk of somebody that may approach you. And also just look at the home. Are there any broken windows or anything unusual that shouldn't be there? So again, it's for your safety and also for an emergency or crisis situation. So in conclusion, your caregiver role is very important for your clients' comfort, quality, safety, and well-being of their life. You know your clients better than I do or anyone else at the office. So whenever in doubt or you're not sure about something, please call us. There are no dumb questions. We look forward to seeing and hearing from you.